With the pandemic restrictions being lifted in some places, gyms, parks, and sports fields are getting more crowded, which means more and more adults and children are participating in sports and exercising, which is great news. But are there dangers? We have a sports and fitness expert right here to answer your health questions next on Dr. Q&A. Hi, everyone, and welcome to Dr. Q&A. I'm Olga Villaverde, and joining us today is our expert, Dr. Sara Filmalter. By the way, she specializes in sports medicine at the Mayo Clinic in Jacksonville. Thanks for coming on the show, Doctor.
Absolutely. Thank you for having me.
Great to have you, let me tell you. Before we get started, Doctor, I just want to remind our viewers that if you want to send in a question, whether it be by email or just a video question of yourself, you can send them to us by email at questions@allhealthtv.com. Give us a call. There's the toll-free number, 855-796-4475. And of course, you can record your question on your cell phone and upload it to us on our website, allhealthtv.com. We would love to hear from you. All right, Doctor, like I said, we've got lots of questions today, so let's dive into the first one. This one is from Mary, and this is what she writes. Let's take a look. I am 79 years old and have osteoarthritis and want to remain as fit as possible. Good for you, Mary. What exercises would you recommend? Oh, Doctor, I love hearing that from someone that is 79 that wants to be active. What would you tell her?
Well, that's exactly what I was going to say, was echo the congratulations and good for you, even getting out there and exercising. I have many patients younger than you that I can't even get to exercise. But with osteoarthritis, we want to be careful with the impact on our joints. So it depends on where in your body you have the osteoarthritis. The most common is in the hands and the lower extremities, or the knees and hips. So if you have osteoarthritis in your knees and hips, then running isn't the best idea for you, nor are squats. Something lower impact like walking, biking, or even water aerobics would be better. And if you do have significant osteoarthritis in your hands, then just careful with lifting weights because it can hurt to hold on to them.
Thank you, Doctor. And a related question, by the way, to that is, are there dangers of overdoing it? And if one does overdo it, what can happen?
Well, specifically with overdoing it in relation to osteoarthritis, if you overdo it, then a good thing to know is that you don't cause damage, but you do cause yourself more pain, and you can get into what we call a flare of osteoarthritis. And it can take a while for that to calm down, days, weeks, or in some cases, even months. And that can put you at a setback for getting back to your exercises. Overdoing it, you can also do that without osteoarthritis, just by exercising too much or too hard too soon. And that can also provide as a setback.
I know someone who actually has osteoarthritis, and I'm glad we have that question that Mary posed, because a lot of people think, well, you know, I'm in pain and doing the exercise is going to be worse for me. But exercise is good, correct, Doctor?
Motion is lotion.
Yeah. That's a great soundbite. And with that, we're going to go to the next question. Here we go. Okay. Mary Ellen, and she asks, I love soundbites. They just get to the point. Here's Mary Ellen. What is the best time of day to exercise? Oh, my goodness. Well, I'm going to just chime in here and say I'm an early bird. I love doing it first thing in the morning. But Doctor, what do you suggest?
The best time of day to exercise, Mary Ellen, is honestly whenever you can. There are some studies that have tried to look at the benefits of exercising at various different parts of the days, and quite honestly, the outcomes are mixed. They do say that we may have more energy and more strength later in the day, specifically mid-afternoon, but really with our busy lives nowadays, you just need to fit it in whenever you can. But I also think an important point to keep in mind with that is that you don't have to do all of your exercise at one time. So if you have 10 minutes in the morning, 10 minutes at lunch, and 10 minutes at the end of the day, that's your 30 minutes for the day.
And Doctor, let's talk in terms of the heat of the day, in terms of, you know, just for example, this morning, I worked out 8 in the morning. It felt like it was 110 degrees. I got through it, but talk to us about in terms of heat, temperature, and what you suggest.
Well, sir, that's a very good point, Olga. It certainly depends on what type of exercise you're doing. If you're exercising outside and you live in Florida, noon to 2 p.m. is definitely not the best time of day to go outside. Early morning would be better, or later in the evening when it started to cool down, which at this point, based on when I've been outside, it seems like it's almost 8 p.m. already. But that would be the most important thing, because heat illness is very real and that it can happen to anyone.
And something I want to ask you, because now it's just curious George here, for example, staying hydrated. We know how important it is, doctor, right? But lots of people will say, before you go running, drink a lot of water. I usually do it after I run. What do you say?
Well, what we've really we bounced back and forth throughout the medical literature as to drink a lot, drink a little, and really we've come back to drink to thirst. It's a good idea to be hydrated when you start exercising, and for that we recommend looking at your urine color. We don't want it to be dark yellow when you start, because otherwise it's hard to catch up. Depending on how long your exercise is, you may actually have to take in some fluid during your exercise, and then certainly, especially if you sweat a lot, you want to make up for that at the end.
And sometimes I'm known to power walk maybe 4, 5, 6 miles, and halfway through I come home to take some water in because I'm really feeling weak, and then I keep on going again. So that kind of helps as well.
Absolutely. And another quick thing I want to just mention with that is that while I love water, water is not necessarily the only thing we should be having. When we sweat, you may have tasted your sweat and it's salty, and we need to take those electrolytes back in. So making sure that we have something that contains the electrolytes so that we keep the fluid inside our vessels for proper hydration.
Any suggestions on what to drink?
I don't like to cherry pick brands. The most common that is used out there are Gatorade and Powerade, but they do contain a lot of sugar. But there are new products coming out all the time with electrolytes and lower sugar. You do need some sugar in there actually to help make the electrolyte transporters work so that we get the benefits from it. So you don't want something that has no sugar, but certainly lower sugar products are okay.
And last question about this, what about protein in drinks? What are your thoughts?
Protein in drinks during exercise are not necessary, but protein in drinks at the end of exercise or throughout the day just provide a means for easy protein access if you don't like eating a ton of meat or anything like that.
All right. I think we covered everything there. So let's move on. I actually want to get to COVID because it's obviously on the top of many people's minds. First, I want to watch this segment, have our viewers watch, I should say. It's about weight gain during the pandemic. Let's take a look.
Pediatricians say the COVID-driven disruption of in-person schooling, sports, and other activities are causing significant weight gain, 20 to 30 pounds in a year in elementary school-aged children. This could put them at risk for type 2 diabetes, asthma, and other conditions. Experts say depression and boredom are leading kids to seek out more comfort foods. Adults are having the same problem.
So the change in our daily routine, whether it's with food or exercise or what we're drinking, alcohol, the stress levels, what we're using as coping mechanisms, all of this can affect our daily weight and our health in general.
Exercise, physical activity, and even just getting outside can help reverse this trend. Studies show spending significant time in nature is critical to long-term health.
All right, so lots to cover here. The first thing I want to talk about, doctors, something that's known now as the COVID-15. I've heard about the freshman 15, when kids go off to college freshman year, we know what happens, right? So now this is kind of the amount of pounds that people have allegedly gained during this pandemic. So if true, what's the best way to start getting back in shape and reverse that? Because we don't want that.
Well, it certainly is true. We actually took to calling it the COVID-19 because it was already being called COVID-19 anyways. So certainly nutrition and exercise are the mainstays for getting healthy again, but starting out slow, because trying to go, if you were exercising before, trying to go back to where you were immediately can be dangerous and lead towards overdoing it and some of the injuries that we we briefly talked about. So just slow and steady and making the changes that you can do in a stepwise fashion.
So if someone was already doing exercise and let's say they became a little stagnant because of COVID-19, would you say slow and steady, or just kind of get back into the rhythm which you were in? And then for someone who has not ever done exercise and wants to start now, what are your suggestions in terms of those two different people?
It's actually pretty much the same, with as long as most of us have been out of regular exercise over the past year, you almost want to start back as a newbie, even if you did exercise before. So as an example, say you were power walking 30 minutes a day on a regular basis. I wouldn't go immediately back to 30 minutes. I would start out with, say, 10 minutes, as long as you haven't incurred any injuries over the past year that are limiting you any further than that. And then do that for it's a little bit of an estimate, but a week or two before moving on to 15 or 20 minutes and 25 and back up to 30 eventually.
So basically build slow and maybe get back to where you were and then maybe add on a little bit more after that.
Oh, absolutely. Yes. Because if you're trying to lose the weight, unfortunately, it can take more than obviously what you were doing to maintain before, but you do want to gradually work back to where you were. It's a common mistake that even I have made, where we think that we can go out and do what we used to be able to do, and we have to work back slowly.
Well, indeed, because about 5 years ago, I was able to run 10 miles, and today, no, ma'am.
Yeah, correct.
I'm not that girl anymore. What about diet and nutrition? Obviously, that plays a role in terms of also getting back in shape, because a lot of people have been home and I guess we could call it binge eating.
Yes. So everybody needs a different amount of calories per day. But what I like to tell my patients are that you need to look at it from 3 different points of view. The first one is, how much are you eating? So there are a lot of calculators that you can go online and calculate based on your age, your sex, your height and weight, what your caloric needs per day. And also you need to look at what types of food are you eating. So typically we do not recommend eating processed, high sugary foods, and that's not a good part of a weight loss program or an overall health program. And then also I tell some patients, if those 2 aspects are not working, for some people you can look at when you're eating, and that is the intermittent fasting. It does have some data behind it, but I think that's very individualized. I really think that the main focus should be on the first 2, which is, what are you eating and how much are you eating?
All right. I have a question here from a friend of mine, and she asks, if you do overdo it and injure yourself, how long should you give yourself to heal? I think that's a great question, because I've been injured before and I'm so frustrated and I wrap my leg and I'll do anything. I'll ice it and I just go back the next day and I exacerbate it.
Right. And every injury is different. I think a good rule of thumb, if I were to just blanket statement, would be take a week off, rest it, and then try and slowly get back. But if you can't, as expected, then see a doctor.
All right. And then the follow-up question to that is, when is it a good time to go see a physician? In other words, what are the signs that maybe you need a little bit more than just ice and heat and you need help?
Oh, that's a great question. Certainly, if you have an acute injury, say you trip and you fall, any cuts, it's good to see a physician. Any significant swelling or bruising, if you can't bear weight, say you roll your ankle and you can't put weight on it, that's a good reason to see a physician. And then I know it seems like we're talking about musculoskeletal injuries, but just to add, of course, if you're trying to get back to exercise and you have any chest pain, palpitations, irregular heartbeat, or any concerning shortness of breath that you wouldn't expect for your level of deconditioning, then please, of course, also seek help.
All right. I have this next question from Jane. I think this is a great question for anyone at any age. What exercises are good for balance? Love that question, Jane. Doctor?
Yes, I was going to say, wonderful question, Jane. I'm so happy that you're looking into balance, because balance is one of the things that helps to prevent falls. And falls are a significant source of injury for all ages, but especially older individuals. Some of the best exercises just in general, physical activities for balance, are Tai Chi and yoga. But say you don't want to participate in either of those, even just starting to put all of your weight on one foot can improve your balance. And I want to say, of course, when you start to do that, if you're not used to doing it, you want to be holding on to a counter or holding on to something first so that you have a source of backup. But if you feel comfortable with that, you can move away from a counter and try it there.
Great stuff. Doctor, as we continue, I just want to remind our viewers again, if you have a question for our expert, as we are doing, we are answering those questions for you. This is how you do it. Email us your questions to questions@allhealthtv.com. Give us a call, so easy, 855-796-4475. Or you can record your question on your cell phone and upload it to our website, allhealthtv.com. All right, doctor, another question here from Lynn, and this is what she's asking. Let's take a look. Are there exercises to relieve nighttime cramps? Doctor?
Interesting question, Lynn, and a little bit tough. I'll say first, if you're having a nighttime cramp in the middle of the night, the first thing that you want to do is get up and stretch that muscle. And actually, the only exercises that really have been proven to prevent nighttime cramps are pretty much the same thing as stretching out the muscles that are cramping at night. So for instance, say it's your calves that cramp at night. Before you go to bed, some gentle stretching would be good. Additionally, muscles that are along the same side, and I'll explain that, are also good to stretch. So for example, if the calves are cramping at night, it's also good to stretch out your hamstrings. They're both on the back of the leg, so they are somewhat connected to each other, and it's good to stretch both then to try and help prevent them.
All right, fantastic. I have here a question that just came in from Denise, and she wants to know, what do you think about taking Pilates classes to strengthen core muscles, and is there a less expensive way? That's a good one. Thanks, Denise.
Yeah. Denise, wonderful question. I absolutely love Pilates. I think that it is a highly underrated exercise because our core strength is of utmost importance. And I would say almost everybody needs additional core strengthening. Cheaper alternative. Well, other than a reformer, there are classes for mat Pilates, which can be additionally almost just as good. And I try not to promote any one thing, but I know that there are some online sites that you can subscribe to. I think it might be Pilates Anywhere or Pilates Everywhere. You can follow with classes there. I think they have a similar thing for yoga as well.
Okay, fantastic. Now, related to that, the pandemic has a lot of people feeling stressed. It has affected a lot of sleep habits, let's be honest. How important are those two things to staying healthy?
Extremely. As far as stress goes, and the video that you aired alluded to that, I loved it, was when our stress level goes up, our coping mechanisms become poorer. So for instance, we just, I don't know, we lay on the couch, we eat comfort food, we binge watch Netflix, haven't been there at all. But that leads towards poor nutritional and exercise habits. It also, that in and of itself interrupts sleep. And if we get poor sleep, we don't make really good judgments the next day as far as doing healthy things for ourselves. We think, oh, I'll just have that extra cookie because it has sugar. It'll give me energy. I'm so tired. I didn't sleep well. I know it probably sounds familiar to a lot of people. But what's encouraging to think about too is actually eating healthy and exercising on a regular basis, even if you don't feel like it, can improve your sleep and decrease your stress. And that has been proven.
I have a question in terms of our seniors. You know, they were hit the hardest during the pandemic, and they've had to quarantine. And I'll be honest, I've been to the mall early in the morning, and I used to love seeing how they walked there in the morning back and forth. And there were groups of people there. Unfortunately, the mall's closed. So what's your advice for them to start getting back and getting active again? Because I think it's imperative at any age, but even more so when you're a senior.
Well, true. Slow and steady, just like we talked about from a physical and musculoskeletal perspective. But truly for our seniors, the social aspect is extremely important. And I'm hoping now that we're getting more and more vaccinations out there, that some of them feel comfortable to start meeting in small groups, especially outside, in order to be able to walk together again. It depends on the facilities that they might have access to, but water aerobics or community pools provide a good way for spacing out, depending on, of course, how they're being run, but also allow you to have that sense of community, social interaction, and exercise.
And that I feel is so paramount, not just the exercise, but the being able to talk. And they would even have little cafecito, Cuban coffees together. It's just a great thing to see.
I do. Absolutely.
Okay, doctor, I have a question here
medical school. Oh, go ahead.
Go ahead. I'm sorry.
I was going to say I went to medical school at the University of Miami. So I spent some time in South Florida, and I know exactly what you're talking about. It was wonderful to see.
There you go. So you know about Versailles and La Carreta and the Cuban coffee.
Yes.
It's a wonderful thing every morning for me. All right, doctor, this question is from Steve, and he writes the following. This is a great question, actually. I've never thought of this. How much protein do you really need per kilogram or pound of body weight to stay in shape and build muscle? And related question, does this recommendation change depending as you age? Wow, I like the scientific kind of question. Doctor?
Yes. Well, Steve, very controversial question, and I'm going to answer it from the medical community's perspective. And the medical community's perspective that as a standard adult, in order to maintain your body weight, you need 0.8 grams of protein per kilogram per day. I memorize it in kilograms because that's our medical field. But if you take kilograms and multiply it times 2.2, then you'll have your body weight in pounds. Or I should say pounds, and divide by 2.2, you'll get to the kilograms. If you wanted to build muscle, then in general, we say to go up to about 1 to 1.2. Now, I know the bodybuilding community has standards that are generally much higher than that, but we in the medical community think that that overdoes it and may be stressing the kidneys with too much protein. And Olga, it does depend with your age. For those who are active or inactive, to be honest, 65 and older, we recommend 1 to 1.2 grams of protein per kilogram per day, just because we need a little bit extra protein to maintain muscle mass as we age, because it naturally does go down.
Unfortunately, yes, true. Thank you, doctor. All right, so we talked about seniors. Yes, we talked about adults. Let's go back to the children. We're seeing the parks getting full, which is nice. Sports field, kids are getting out there in the playgrounds. Any concern for parents who may be, just worried about putting their children at risk still, and maybe overdoing it as well?
Well, I think if they've actually studied extensively the transmission of COVID within youth sports, and it is minimal, if any. So really, I think that we've proven that we really should get our kids back to youth sports, because that's not where they're picking up COVID. They're picking it up from schools or their friends outside of sports. From just an overdoing it standpoint, kids are extremely resilient, and so their musculoskeletal systems will keep up. That's not a problem. It's really about making sure that they are either acclimatizing well to the heat, because they still are prone to heat illness, just like adults are, and making sure that they stay hydrated, simply because they're not thinking about it. So as parents, we need to be responsible to say, all right, you can't go out for 2 hours your first day out in the middle of the day in the sun, and I'm not going to send any fluid with you. We need to remind them.
Absolutely. We have about a few minutes left in the show, doctor. I have a couple more questions I want to get to. Real quick, I want to remind our viewers, if you have a question for our expert, really easy to get in touch with us. You can email us, you can call us. Let's show you the information. Send your question to questions@allhealthtv.com. And you can also give us a call, 855-796-4475. Or you can also just post the question on your cell phone and download it right there on our website, allhealthtv.com. All right, a couple minutes left, doctor. I do want to get to this question. How does someone know whether it is time to see someone like you as opposed to, let's say, primary care? Because there are times that one waits too long. Primary care maybe, was the right route, but maybe should have been to the specialist. What do you say?
Well, I generally always say it's never a bad idea to see your primary care doctor first. They're the ones you have a wonderful relationship with and they know you best. But what is true is that all primary care doctors have a different level of comfortability with musculoskeletal or just sports injuries in general. And so if they don't know the answer, or if you can tell they don't know the answer, either way, always asking for a referral to a specialist is never a bad idea. But sometimes the primary care is able to take care of you.
And last question I want to tell you is, actually, it's not a question. I wanted to just chime in on it. I was never a power walking fan. I've always been a runner. But since I started power walking, and I just want people to know, when they say walk and power walk, it really does make a difference. I've actually become an advocate.
Yes, absolutely. I'm a runner too. And I tell my patients I will run until my body tells me that I can't anymore. But that puts me in a perspective that I also understand how hard it is for people to give up running and transition. But really, when you get used to it and you get used to spinning or cycling or power walking, they really get your heart rate up, they get the endorphins up, and they're still a very enjoyable, productive form of exercise.
Doctor, thank you so much. It's been a pleasure having you on the show. We hope to see you soon again.
Thank you. Absolutely. Thank you.
Have a great day. Appreciate your
You too.
time. And that's all the time we have for today. Thank you so much for joining us here on Dr. Q&A. I'm Olga Villaverde, and we hope to see you next time. You stay safe.
The Health Channel wants you to have all the answers you need to be in control of your health.
Infection and the virus keeps coming back.
That's why, in addition to Dr. Q&A,
if treated appropriately, the patient should...
you can always chat with one of our health advisors through our free service, Ask Hannah. Just go to allhealthtv.com or download the Health Channel app and get the answers you need.
No question should ever be left unanswered. Remember, if you don't know where to start, ask Hannah.